Ooh, ah. Hello again, everyone. It's Ryan Liberty, and welcome back to this series on everything that you need to know about trauma and PTSD. In this section, I'm going to be talking about complex post-traumatic stress disorder and the relation of trauma, complex post-traumatic stress disorder, and personality disorders. Complex post-traumatic stress disorder. Complex post-traumatic stress disorder is also known as complex PTSD or CPTSD. It is not officially recognized as a diagnosis. However, as of the time of the making of this, it is up for inclusion for the ICD-11. The ICD-11 is currently in beta, and in it, we have a description of what complex post-traumatic stress disorder is. That description includes that it is a reaction to a traumatic event or a series of traumatic events that are prolonged and repetitive in nature. Those events are horrifying and extremely threatening, and escape from them is difficult or near impossible. The ICD-11 includes some examples of events that would qualify, and those include things like torture, slavery, a genocide campaign, prolonged domestic violence, or prolonged sexual abuse or physical abuse in childhood. For complex PTSD, all of the requirements of PTSD would be met. However, there are some additional criteria. Those include having difficulty regulating affect, also known as regulating your emotions, feeling this pervasive sense of being diminished, worthless, and having accompanying pervasive feelings of guilt, shame, and failure around the traumatic event, and having difficulty sustaining relationships and feeling close to others. Complex post-traumatic stress disorder and personality disorders. Research has come to no definitive conclusion that complex post-traumatic stress disorder and personality disorders are linked. Studies do seem to show that trauma and personality disorders are linked, but the studies do not indicate in which direction that goes, whether somebody starts with a trauma disorder and then that predisposes them to having a personality disorder, or if somebody starts with a predisposition to a personality disorder, which makes it difficult for them to have resilience to trauma and then go on to have a trauma disorder. All of these studies do seem to remind us that trauma is only one factor in whether a personality disorder will eventually develop. Most of the studies seem to focus on one particular personality disorder, which is borderline personality disorder, also known as BPD. Childhood trauma does seem to be a factor in whether or not somebody will develop borderline personality disorder. A 2014 study distinguished that post-traumatic stress disorder, complex post-traumatic stress disorder, and borderline personality disorder are all separate and distinct categories of disorders. What distinguished borderline personality disorder from complex post-traumatic stress disorder was a frantic effort to avoid abandonment, an unstable sense of self, unstable and intense interpersonal relationships, and impulsivity. Just as a reminder, research has not come to any definitive conclusions about anything that we've discussed. If you have any questions about complex post-traumatic stress disorder or its relation to personality disorders, please leave those down below for the rest of the community. And if you're enjoying this series on everything that you need to know about trauma and PTSD, please subscribe.